Question 1. A state of emotional, psychological, and social well-being where an individual realizes their own abilities is defined as A. Mental wellness. B. Mental health. C. Cognition. D. Affect. Correct answer. B. Mental health. Mental health is the formal definition for the overall state of psychological and social well-being. Question 2. Which term describes a clinically significant disturbance in an individual's cognition or emotional regulation that reflects a dysfunction in psychological processes? A. Mental illness. B. Psychomotor agitation. C. Flat affect. D. Defense mechanism. Correct answer. A. Mental illness. Mental illness or mental disorder is characterized by a disturbance in thinking, mood, or behavior that causes distress or impairment. Question 3. Mental wellness is best described as A. The absence of any mental disorder. B. A fixed state of happiness. C. A continuous effort to maintain emotional balance and coping skills. D. The ability to ignore stressful situations. Correct answer. C. A continuous effort to maintain emotional balance and coping skills. Wellness is a proactive, ongoing process of maintaining balance and resilience. Question 4. Physical movement specifically associated with mental activity is known as A. Catatonia. B. Orientation. C. Psychomotor activity. D. Perception. Correct answer. C. Psychomotor activity. Psychomotor activity refers to motor behavior that originates from mental or psychic activity. Question 5. A patient is observed pacing the floor and wringing their hands repeatedly due to internal tension. This is documented as A. Psychomotor retardation. B. Catatonia. C. Psychomotor agitation. D. Flight of ideas. Correct answer. C. Psychomotor agitation. Psychomotor agitation involves excessive, restless, and non-productive movements. Question 6. A nurse notes that a patient with severe depression takes an unusually long time to stand up and speaks very slowly. This is A. Psychomotor retardation. B. Blunted affect. C. Tangentiality. D. Regression. Correct answer. A. Psychomotor retardation. Psychomotor retardation is the visible slowing of physical movement, posture, and speech. Question 7. A patient remains in a rigid, fixed position for hours and allows the nurse to move their arm into a new position, where it stays. This is a sign of A. Psychomotor agitation. B. Catatonia. C. Somatic delusion. D. Obsession. Correct answer. B. Catatonia. Catatonia is a motor disturbance that can include immobility or waxy flexibility. Question 8. Affect is best defined as A. A person's inner feelings. B. The external, observable expression of emotion. C. A fixed false belief. D. The ability to solve complex problems. Correct answer. B. The external, observable expression of emotion. Affect is the weather or the outward sign of a person's emotional state that the nurse observes. Question 9. A patient shows absolutely no facial expression or vocal inflection during a conversation. This is documented as A. Blunted affect. B. Label affect. C. Flat affect. D. Inappropriate affect. Correct answer. C. Flat affect. Flat affect is the total absence of emotional expression. Question 10. A nurse observes that a patient has a significantly reduced intensity in their emotional expression. This is known as A. Flat effect. B. Blunted effect. C. Label effect. D. Inappropriate effect. Correct answer. B. Blunted effect. Blunted effect refers to a reduced or dulled emotional response. Question 11. A patient shifts from laughing to crying within seconds without an obvious trigger. The nurse documents this as A. Label effect. B. Inappropriate effect. C. Flight of ideas. D. Circumstantiality. Correct answer. A. Label effect. Label effect is characterized by rapid, unpredictable shifts in emotional expression. Question 12. A patient laughs while describing the details of a tragic car accident. This is an example of A. Flat effect. B. Blunted effect. C. Inappropriate effect. D. Label effect. Correct answer. C. Inappropriate effect. Inappropriate effect is an emotional response that does not match the content of the speech or the situation. Question 13. A patient provides excessive, tedious details but eventually answers the nurse's question. This is called A. Tangentiality. B. Circumstantiality. C. Loosening of associations. D. Clang association. Correct answer. B. Circumstantiality. Circumstantiality involves unnecessary detail but eventually reaches the point. Question 14. A patient begins to answer a question about their family but ends up talking about the history of trains without ever answering the question. This is A. Circumstantiality. B. Tangentiality. C. Flight of ideas. D. Obsession. Correct answer. B. Tangentiality. Tangentiality occurs when the speaker drifts off topic and never returns to the original point. Question 15. A patient exhibits rapid, pressured speech and jumps quickly from one topic to another based on understandable links. This is A. Loosening of associations. B. Flight of ideas. C. Clang association. D. Circumstantiality. Correct answer. B. Flight of ideas. Flight of ideas involves rapid shifts between topics, often seen in manic states. Question 16. A patient says, "The light is bright, I want to fight, I am a knight." This is an example of A. Tangentiality. B. Loosening of associations. C. Clang association. D. Word salad. Correct answer. C. Clang association. Clang association is the choice of words based on rhyme or sound rather than meaning. Question 17. A fixed, false belief that is resistant to reason or contrary to fact is A. Hallucination. B. Illusion. C. Delusion. D. Phobia. Correct answer. C. Delusion. A delusion is a thought-based error where a person believes something that is not true despite evidence. Question 18. A patient claims they have a secret bank account with trillions of dollars and are the rightful heir to the throne of England. This is A. Grandiose delusion. B. Persecutory delusion. C. Somatic delusion. D. Loosening of associations. Correct answer. A. Grandiose delusion. Grandiose delusions involve exaggerated beliefs of power, wealth, or importance. Question 19. A patient is convinced that their heart has stopped beating and their blood is turning into water. This is A. persecutory delusion. B. Grandiose delusion. C. Somatic delusion. D. Visual hallucination. Correct answer. C. Somatic delusion. Somatic delusions are false beliefs regarding the body's physical functions or health. Question 20. How the brain interprets sensory information is known as A. Cognition. B. Orientation. C. Affect. D. Perception. Correct answer. D. Perception. Perception is the process of interpreting stimuli through the senses. How many questions did you get correctly? Drop your score in the comment section below. I'd love to see how you did. Make sure to subscribe and turn on the bell notification to get notified when we drop our next video.